Great. So thanks very much for three excellent talks. I'm just going to start off perhaps, Parveen, with you. One of the comments that's come through is that the relationship between antimicrobial resistance and climate change, whether that's accelerating that. Do you want to make some comments on that issue?
Adrian, thank you. That's an excellent question, absolutely excellent, because that's our other crisis that's going on at the moment. And I think if we carry on the way we're going, we're soon going to have no antibiotics for minor things like pneumonia, and we'll see death. And I think the last crisis, the first wave, was really pretty bad in showing that we were bad at using antibiotics. Particularly, I think, the dentist who said if you had a toothache, take an antibiotic. So all we were doing was really making it more resistant and spending more. So the answer is yes. How we can link the two, I don't know, but I think it may well be that you have to do it in parallel, because what's going to happen with the number of diseases we're going to get with the climate getting hotter, it may well be that you need antibiotics. And at the moment, unfortunately, if you have a temperature or a cold or whatever, a cough or whatever, it could be COVID, it could be a virus, or it could be a bacterial infection. And at the moment, we don't have that single one-point test at the bedside, which will tell us whether it's a viral infection, which you don't treat with antibiotics, and a bacterial one that you do.
Dermot, one of the talks is really, the questions rather, was what are the low-hanging fruit with regard to realistic international solutions? Clearly there's so many different aspects to that, but is it heating rooms? Is it energy on a sustainable manner? What do you think are the things that are realistically achievable and maybe coming up in the COP26 discussions?
Well, I think the things that are realistically achievable at the sort of the global level, in addition to the things that Emily's just really described so well about what we can do individually with our own actions and to mobilize together, I think is about probably the most important thing is in the incentives that will drive the transition to a clean energy system or a clean food system. At the moment, we, as a society, massively subsidize really polluting and unsustainable forms of food consumption and energy consumption. And that, most of the subsidies that we provide, they should, if we're providing subsidies, we're spending taxpayers' money, it should be to do something good. And yet at the moment, it's doing exactly the opposite. And so I would suggest that at the macro level, it's about things like carbon taxes, which also are designed so as to take into account the improvements in human health that you would get. But I think, if I can say one other thing in addition to that, it's also just the culture change. I'm also looking at some of the other questions about the fact that if we increase efficiency, won't that just drive more economic growth? Well, it depends if it's what people want or not. If what people want, if what is considered desirable is the faster and bigger car, then yes. If the culture is changing, and I think it is changing, so that what people want is actually the healthier, the more sustainable choice, then I think that increase in efficiency can go with improvements in carbon emissions. But I think, unfortunately, we're past the stage where we can just pick one thing and say we'll do that. We have to do all of it now. We have to drive those big macro changes. We have to have culture change throughout society, and we have to do those individual actions as well.
Actually links on nicely to the question here for Emily. A comment that could you list the top 3 most effective lifestyle changes you can make to mitigate one's own contribution to climate change on an individual level? So can you give us your top 3? Thanks.
Yeah, thank you for that question. It's a really good one. I'd like to start by saying everyone is different, and that's why I was quite clear in the talk I was asked to give about individuals and what we can do. I didn't want it to be a prescriptive talk about these are the things you should do, because people have different abilities to be able to do things, and what's relevant for me might be completely not relevant for someone else. For example, I am talking to you from my caravan. That tells you that I've got a garden that's big enough to have a caravan in it, which means for me, I can look at how to grow my own food in my garden. That doesn't apply to someone who is living in a tenement flat and doesn't have access to a garden, but they might be able to join a community garden. So I really genuinely believe that people need to look at themselves and their own lifestyles and their own power that they have or maybe don't have, and then that is relevant to what their individual actions might be. I think there's also a challenge around trying to tell people how to behave from a health perspective. Therefore, I feel sometimes I can talk to people within their work environment and say, what can we do together at work? But do I really have a right to tell someone how to live in their own personal lives? And so again, it's a very personal choice. But if you were asking me from a personal perspective, then I would say to think about the power we do have as consumers, and therefore, think about what you consume. How do you use your money? As medical professionals, look at where your money is being used. We work hard to earn money, and actually how are people using our money that we spend? So look at your purchasing power. The things that you buy, are they fair trade? In which case, do they give the right amount of money to the individual who's receiving them? So I think a big one would be thinking about how you spend your money. And secondly, you want three. I think look at your consumer power, look at your waste, because that's a big issue. And thirdly, how you live as a role model to other people. Dermot touched on this. Doctors are very trusted by the public. Nurses are very trusted by the public. Don't be afraid to use your voice, to speak out, and to do it in a way that will make those around you want to. Not in a judgy or a preachy way. Think about how we live as role models, as people who work in healthcare. I think they would be my three things. A long way to get there. Sorry.
Oh, thanks very much. And time's a bit tight, but I just want to comment, and there's a couple of questions there about PPE. In other words, national government level focuses and attempts to eliminate risk rather than balance it, especially the single-use items such as PPE. And I think given COVID, we're all very conscious of massive amounts of pairs of gloves, single-use aprons, etc., being put in the bin, and in an average day going through as an individual many of these things. Do you think in this day and age of defensive practice we can ever go back to using non-disposable gowns and non-single-use surgical instruments? Any quick comment from anyone in the panel?
Sorry if I may, I think we've got to try and think of ways of not using disposable stuff. I'm a gastroenterologist, as are you, Adrian, and the endoscopy is an area where we can certainly make lots of changes. So I think we just got to think in a different way, and try and find not disposable stuff and use things again and again if we can.
You could talk about this.
Emily's nodding. Maybe she wants to talk.
No, I was just going to agree. I was just going to agree with you. I don't think we have an option to say we just need to. I think we have to. We've got plenty of clever, inspiring people around that will find ways, and we have to trust that will happen and encourage people to think like that.
Thanks very much, everyone. Appreciate your time, and as I say, we could have talked for hours on this. So given the situation, I'm going to say thanks to you, to the three of you, to Emily, Dermot and Parveen, and I'm going to pass on now to my colleague, Professor Jeremy Bagg, who's chair of the College Global Health Group, and he's going to chair the second session. Thanks.